Hey Hygienist, welcome back to my channel for another video. If you are new here, my name is Kalesha and I am a registered dental hygienist. Be sure to hit that subscribe button to become a dental hygienist yourself and to contribute to the growth of this channel. So in today's video, I want to go over one of my favorite things as a dental hygienist. Okay, this first one is teeth whitening. Oh my god, if I could do teeth whitenings all day, I would, but that's not what this video is on. I want to talk about my second favorite thing, which is deep cleanings, scaling and root planing. I feel like as a dental hygienist, our job can get so routine with scaling, flossing, polishing, so forth and so on. But when we get a deep cleaning in the chair, we have to think harder. We have to get out some old instruments that we don't always use. We have to use our muscles. We have to thoroughly educate our patients. There's just so much that goes on when we're presented with a case that is unusual. So I love being challenged by deep cleanings. I feel like that is why I got in the field. It just breaks up the regular routine of a dental hygienist. So absolutely love deep cleanings. And I want to talk about that today. So I also got a comment, a video recommendation on one of my videos. You asked me to make a video on how I explain the need for a deep cleaning to my patients and how I get those difficult patients to accept treatment. And I think that's a great question because I see and encounter it all the time. I go through my whole diagnostic talk of why the patient needs a deep cleaning instead of a regular 6-month cleaning, and some of them still like, so you can't clean my teeth? You can't just do a regular cleaning? And I'm like, no, and I'll go deeper and explain why, and then they'll still opt out of it, and eventually they come around to it, and I want to tell you and show you all how I do that on today. Also, at the end of this video, I'll be sharing an actual deep cleaning appointment with you all. So if you want to see what happens during a scaling and root planing deep cleaning visit, stick around for the rest of this video. In dental hygiene school, during clinic, and also during your dental anatomy and different courses, you learn how important your vocabulary is when you're presenting cases and information and oral hygiene instruction to your patients. So you definitely want to have the knowledge yourself as to how periodontal disease starts, form, and the progression of it. Now, if you feel pretty confident in that area, good for you, kudos to you, but your patients may not understand what you're saying because, let's just say it, dental hygiene jargon is a little hard to wrap your mind around. But to make it easy for patients to understand, I love using the periodontal disease flip chart by ADA. It's an old one, but it's still very relevant to today because, I mean, periodontal disease really doesn't change, okay? This flip chart targets how periodontal disease develops, diagnosing periodontal disease, treating periodontal disease, preventing periodontal disease, and it explains the importance of regular dental visits. So let's take a look into this flip chart and I'll explain how I use it when I'm discussing periodontal disease with my patient. So when you're about to get ready and talk about periodontal disease with your patient and letting them know that they are either advanced, moderate, or just beginner's perio, you want to always relate it to how healthy gums and how a healthy mouth looks so that they can understand the severity and the difference between the two. So the first page in this flip chart is a reference to how healthy gums look and explains how the tissues and everything will appear. So it says the teeth has little or no plaque buildup along the gum line. The gums are usually pink and tight, and that the periodontal ligaments, the supporting structures around the bone in the teeth, firmly anchors the teeth into place. And then there's, of course, no bone loss. That is a healthy mouth. Usually your every 6-month routine cleanings, and they have, of course, great home oral hygiene care. Then we move on into gingivitis, where over time plaque builds up along the gum line of the teeth. The gums become red, swollen, they bleed when brushing. Now your periodontal ligament during this time still firmly anchors the teeth in the jawbone, and there could still be no radiographic bone loss present. But as you can see now on this picture with gingivitis, there's a little bit of plaque that shows along the gum line. So having the smile and then the kind of like a fictional tooth and bone relationship there, you can see where the plaque is kind of building up for a great visual reference for your patients. And then next we move on to mild to moderate periodontitis. So we've crossed over from gingivitis into perio now, and this is where plaque typically builds up above and below the gum line. Plaque that would usually be soft will calcify and turn into tartar or calculus, and the roots may become exposed and the teeth are now sensitive. Now the surrounding tissues and the ligament around the teeth begins to break down and lose support. Now there's mild to moderate bone loss, and the teeth may begin to wiggle just a little bit. Again, for the reference picture, you can now see the recession, and for the fictional purposes, you can see the gums being inflamed, the tartar above and beneath, and then of course the recession that it shows as well, and how the bone has declined. And now we're moving on into the thick of things. Into the thick of it. Into the thick of it. Okay, nah, for real, because this ain't no joke. Okay, so advanced perio. Now the plaque has continued to build up above, but most of it now is below the gum line. This is just a literal progression of everything I just explained in mild to moderate. Now you have your pockets are deepened, where it will be healthy, where there'll be healthy attachment. Now your teeth are wiggling, they're a little bit mobile, and they just continue to lose support, and the overall look of your smile has gone downward. You know, it's not where it once was, and it looks apparently unhealthy, and you can see that in the picture that it shows there. Once you've used this flip chart to kind of describe what gingivitis along with mild, moderate, and advanced periodontitis is, and your patient still isn't really convinced, this is where you want to pull up the x-rays that you took on your patient along with any intraoral photos. Of course, to even diagnose periodontal disease and the need for a deep cleaning, you have to have done a periodontal exam already. You had to have probed, and you had to have taken x-rays. So I highly recommend using the own patient's x-rays and photos. This is how you're gonna drive it home, because not only did they see it on this flip chart, they're gonna say, this is in my mouth, like in my mouth right now. And I'm like, yes, this is in your mouth. I can't make it up. You saw we just took these pictures, and now they're laid out here for you to see. So after they have gotten a general idea of what a deep cleaning is, why they need it, you want to go ahead and thoroughly explain the appointments and the different things that are involved with periodontal disease. You want to explain periodontal probing, how we can measure the bone loss to see exactly what state that they're in, and what we can do to dial back some, what we can do to work back toward health, and even if a certain level of health is even achievable. You want to try and be as realistic and as honest as possible, no matter if it hurts. Okay, we're here to help the patient, not harm the patient, but we have to be honest and straightforward about how treatment can improve their oral hygiene. This flip chart also goes into periodontal probing, how a periodontal probe shows against healthy gums and how it shows pockets. Also on the next page, it goes directly into dental x-rays and how we use dental x-rays to diagnose periodontal disease. So this is where I'll pull up their x-rays and I'll point to their current bone level and where it should be. And then I can also show them the tartar buildup underneath their gum lines. So this is a great visual for the patient to understand their current periodontal status. So after you've gone over all that, you'll still have this one patient that says, so you can't just do a regular cleaning? Did I not just go over all of that stuff as to why I cannot do a regular cleaning? But trust me, you're still gonna get that question, okay? You're still gonna get the question, so you can't just do a regular cleaning? No. And this is where you can pull that flip chart out and show again scaling that's above the gum line versus scaling that's below the gum line, and even deeper with the amount of plaque and tartar buildup, how no, I cannot just do a regular cleaning. I'll be doing you an injustice. Now if the flip chart along with their actual images and you explaining everything in detail doesn't work, and you still have that difficult patient that just doesn't want to consent to treatment, this is where you get kind of brutally honest, and you may just want to say, no, I cannot clean your teeth that are just gonna fall out. eventually. No, I'm not doing it. It's a disservice to you. This will cause me to be up at night because I didn't give you quality care. And then if they still don't want to do it, you can just refuse treatment. I mean, there's no reason you have to see that patient. They can just go somewhere else where they're okay with doing the bare minimum. But you are not. You are not, as a hygienist with integrity, you're not going to do a regular cleaning on someone that needs a deep cleaning. That is just a no-no. So if you have that difficult patient and you know you've done every single thing you can to get this patient to understand, you've brought in your team members, your dentist, you've done everything. You've pulled up videos of how the procedure is going to look, someone else explain it. You have done everything within your power, your scope of practice as a dental hygienist, and they still don't want to do it. Dismiss the patient. That's all I gotta say. Dismiss the patient. But if you have that patient that just needs it thoroughly explained and you do a good job of doing that, then it's gonna be 100% acceptance, okay? They're gonna accept and they're gonna get going with it. And if you have that patient that gets going, patient that accepts treatment, then of course you as a hygienist already know exactly what the appointments will look like. So now that you've stuck around for the end of this video, I wanna go into a day in the life when I actually get a deep cleaning or SRP inside of my operatory. Don't throw no guys saying. Come through and come in.
Are we live?
Say what?
Are we being recorded?
Yeah. You need to email. Alright, last little bit. Finna get in there. Yeah. Not for real. But what I just did was put the little topical jelly on his gums already. So this is gonna make the needle injection less painful. Okay, so he can vouch that he's shaking his head like it be hurting. It don't hurt. It don't hurt, y'all. But you know, if you got a needle phobia, sorry, sometimes you just gotta man up or woman up and get the job done. So we are handling the left side today, which we've already done the right about a few weeks ago. So on the first visit of my patient, these were his x-rays. I want to go a little closer and show you all what the tartar looks like in between the teeth. This is tartar, these little specks in between the teeth. These are of course on the front tooth. As you can see, this is below the gum line on all of these photos, and then a little bit more right here. So it was just throughout, all throughout on all of the x-rays. So that's how I knew right off the bat that it would be a deep cleaning along with the periodontal chart. Okay, so today we are just tackling the left side. So we've already done the right, and the after is pretty much this. As you can see, all of the tartar is gone in between the teeth. Show you another picture, and there we go, all of it's gone on the right side. So now we'll be tackling the left side today. So I'm excited to get going with that and finishing up. So let's get going.
Doing today? Good. We're going to be working on the left side today. Nice toothbrush.
Yeah. Ooh.
I know I'll be shaking your lip a lot, but it's just so you don't feel it.
Oh, okay.
It's not shaky hands, it's just I shake it as sort of a distraction technique, okay? I like to always remind you that so you don't think I'm coming at you with a shaky hand. Starting in this upper area, just put your hand up if you need a break from it all, okay? You're gonna start right here. It's gonna feel a little funny under your nails. Just shake, shake, shake a little bit. Good job. You're doing great. And open wide up. There we go. And then there will be pressure with this one, but not shaking. Doing great. Good job. And 1, 2, 3, 4, and 5. You did it. Everything's done now. So yeah. That's what you do wrong, I guess.
Oh gosh, later.
Wait.
Feel it.
Mm-hmm.
What you feel it?
Mm-hmm.
You don't? Well, how you feel? What about now? You feel it? Okay. Sorry. I'm just trying to see if you feel it. Okay, I do have to call her back in here to talk. Okay. Okay. I'm sorry. Numbing jelly is your friend. Don't tell them that. We should be informing them to not go without.
Listen, if you feel it, say something.
Yeah.
Okay? Trust me. Say something.
So after removing all of the subgingival tartar, I like to go ahead and probe. So periodontal probing measures the distance from the deepest extent of the pocket that surrounds your tooth to the surface of the tissue. This is one of the hygienist's most important tools for determining the condition of the gums, what type of cleaning is needed, and measuring the success of treatment on subsequent appointments. So after probing, these are pretty much the numbers that I got. As you can see, all of the red are inflamed pockets, the 4s. And then as we move to the posterior teeth, we got a couple 5s. So of course, that just lets me know that there is inflammation and bleeding throughout. And this is what we're gonna send to the insurance company so that they can pay for treatment. Check behind me still. Make sure I got all of it out.
You did.
On both sides.
You did.
Alright, we're gonna try it.
Whoa.
It's not. Okay. Alright. Leave no regard for my finger. You ain't catch it, but you know you bite quick and hard. We're gonna have a problem. Okay, bite too fast on this side. I see one more little piece. And then the crowd area over here on the lower left. Like that. See it right there, just a little small piece.
People tell me.
No. Then it'll be even harder to go in and get it out when you ain't known. So much rather to get it now. I think it'll sit right on top of them. Alright, I got it. Alright,
Why are you ready? Look, y'all, if you need your teeth clean, any type of dental work, come see Kalesha. She does the job. Oh.